Welcome to Broken, Bankrupt, and Dying, a brief overview of the U.S. healthcare system. As we head into the next election season and continue to try to combat the global COVID-19 pandemic, it's more important than ever that we have in the forefront of our mind what's wrong with the U.S. healthcare system and what needs to be done to fix it. The U.S. healthcare system is the greatest ripoff of the American people in the last century. Now, that sentiment may be a little off-putting, but honestly, I don't know how else to describe a situation where Americans are overspending on healthcare by more than $1 trillion per year in excess costs for the privilege of dying younger than people who live in other countries. The U.S. healthcare system is going to have to change because, as I'm going to show you, it's bankrupting us. And for the incredibly high costs we spend, frankly, we get poor outcomes in result. There's many experts out there that measure healthcare performance, but one of the most respected is the Commonwealth Fund. The Commonwealth Fund is a US-based nonprofit, nonpartisan think tank that evaluates international models of healthcare systems to try to help countries improve. One of the reports they release every few years is an updated list of the performance of healthcare systems in 11 wealthy peer nations. How does the US stack up to our wealthy peer nation competition? Well, overall, we're ranked dead last, 11th out of 11. We're also dead last on access to care. We're next to dead last on efficiency of care, and we're dead last on equitability of care. You might think, yeah, but the US is the wealthiest country in the world. We have the most highly trained physicians and nurses in the world, and we have the best medical technology in the world. So surely we must lead the world in saving lives. No, sorry. On death amenable to appropriate healthcare delivery outcomes, we're dead last, 11th out of 11. Being dead last on dying, pun fully intended, that's kind of bad. In healthcare, generally, we tend to strive to not have death occur. That's kind of the whole thing of healthcare. If you're going to lose on something in healthcare, lose on the food in the hospital not tasting good. Don't lose on dying. Now, there's lots of other studies out there that validate these findings. I'll just show you one as an example. This is a study of 195 countries and their healthcare systems, funded by the Gates Foundation and published in the highly respected medical journal, The Lancet. There were 75 countries that had enough data available for the investigators to compare death amenable to appropriate healthcare delivery to prevent, across these countries. And where did the US rank? We ranked 35th out of 75 countries, middle of the pack, mediocre at best. You can see the US here on the slide about 2/3 of the way down, this yellow bar that runs across the slide. Let me expand that up for you so you can see who our immediate competition was. On death preventable by appropriate healthcare delivery, we tied with Estonia and Montenegro. Yeah. The good news is we beat Lebanon, but the bad news is that we lost to Kuwait and Croatia on death. Now, you could also just look at average lifespan. Here's data from the media conglomerate Bloomberg showing average lifespan of many countries. And you can see once again, here we are in the US, middle of the pack. But there is one healthcare category in which the US demonstrates its true exceptionalism. And that, of course, is cost. In 2018, the United States spent $3.65 trillion on healthcare, which is enormously more than any other country in the world. You can see here all the other countries in the world, including wealthy countries, poor countries, doesn't matter, spent way less than us and all clustered relatively closely together. And then here we are ramping up this massive increase in costs as the US. The $3.65 trillion that we spent just on healthcare in 2018, if that was its own country, if US healthcare was its own country, it would be the 5th largest economy in the world. We spent more just on healthcare in one year than the entire value of the entire economies of all other wealthy nations from the UK on down. That is an outrageous amount of money to spend to get mediocre outcomes on death in return. Now, this is one of the most extraordinary graphs I've ever seen. It plots on the x-axis down here cost per person for healthcare. So total healthcare cost divided by the number of people living in the country, plotted against on the y-axis the average lifespan in those countries. And then it's per year. And you can see here that year after year after year, most of the industrialized countries in the world all cluster relatively together up here. And then there's this one straggling outlier, like sort of a rogue eyebrow hair that you're just desperate to pluck, and that's the United States. Now, on a graph of healthcare cost per person versus lifespan, you don't want to be down and to the right, because that means you're spending more money to live shorter lifespans. Here's all the long lifespans way up here, and then the shorter lifespan way down here, and here's the much higher cost way over here compared to everybody else. What do all of these countries have in common? They have universal healthcare systems. The US is the one country that doesn't. The other point I'm going to make is that you can see that for most of these countries, year after year after year, their lifespans increased. For us in the United States, that stopped in 2014. And in point of fact, for the last 5 years, we've experienced a steady decline in our average lifespan of about a half year on average. And while our lifespans have been shortening, we've actually increased our expenditures by 22%. We're paying 22% more to live shorter lives. Something is wrong. Now, that's the national cost of healthcare. What about the cost to employers and their employees? In 2019, the Kaiser Family Foundation released a survey of 2,000 employers. And what they found was the average cost to purchase a family health plan for an employee to cover the employee and their family is now $20,000 per year. The cost of a new car every year just in premiums to purchase the policy. Now, remember, that doesn't cover all healthcare costs. We're going to get to that point in a minute. About 70% of that $20,000 per year is paid for by the company, and about 30% is paid for by the employee. Now that amounts to, in 2017 dollars, $1.1 trillion per year that US businesses are spending to purchase health plans for their workers. In other countries, companies don't spend their own money to purchase health plans because people have national health care. And this places a huge sort of hidden tax that disadvantages US companies on international markets. Imagine if they had a big portion of that money back to reinvest in their businesses. Now, remember that a few years ago, the Republicans were very proud of passing a tax cut, a corporate tax cut, which they said would grow the economy and create jobs. The annual US corporate tax collections, $320 billion per year, which means that companies spend more than 3 times more of their own money to purchase health insurance for their workers than they spend on annual corporate taxes. If they had some of that money back, they could grow their businesses and be much more competitive on international markets. And if the employees had some of that money back, they would be getting paid higher wages. Now let's talk about the personal cost of healthcare. We live in an era of record low inflation, 2% per year. And according to the US Department of Labor, Americans are actually making raises of 3% per year on average. So pay raises are going up ahead of inflation. So we have this paradox, because why is it that when you ask people, they will tell you they feel like they're falling further and further behind every year? The resolution of this paradox is very easy. Yes, on paper, US workers are making more money every year. Inflation's at 2% per year, wage increases are 3% per year. But healthcare in the US, that's going up at 5% per year, which means that every dollar they make in a pay raise and more is getting sucked into their rising healthcare costs. The US healthcare system is pushing the American worker behind. Now, I alluded to gaps in coverage before. For the $20,000 per year in premiums that you pay to purchase a health plan, there are still massive gaps in coverage in the US and not in any other industrialized nation. For $20,000 per year in average premiums, the average deductible, what you have to pay before your insurance kicks in, is $1,600 per year. And you add in that $1,600 average deductible and other gaps like copays and coinsurance and per diems. And Americans are paying 24% of their healthcare costs out of pocket, even after spending $20,000 a year just to purchase the health plan. And this explains why, even after the Affordable Care Act insured 18 million more Americans, we have these persisting gaps in coverage that have led to a persistence of more than 500,000 medical bankruptcies per year, people declaring personal bankruptcy due to medical bills. You know what that number is in Europe? 0. Enter COVID-19. COVID-19 has torn the veneer off the US healthcare system and exposed the rot within. 40 million Americans have filed for unemployment due to COVID-19, and the US is the only country that links health insurance and hence healthcare access to employment. So let's do a quick pop quiz. Let's check your test-taking abilities. A healthcare system that strips away people's health insurance and hence healthcare access in the middle of a global once-in-a-century pandemic is A, suboptimally designed, B, harmful to the individual because they can't get healthcare and they may have a fatal disease, C, a great way to spread the virus further because they can't get healthcare so they won't get tested so they won't know they have the virus and they won't quarantine, D, unwise public policy, or E, all of the above. Clearly, the system that we have is not working. And one of the amazing things to me is that when you talk to people about what should be done, what you tend to hear is, well, we should take the system we have and cover more people. We should expand it. We should use the existing exchanges under the Affordable Care Act and allow more people to purchase plans in those exchanges. Really? We've just described how we overspend by more than $1 trillion in excess costs per year to deliver bad outcomes. You want to lean into the ripoff and spend more money on that system? I don't think so. What we need to do is reform our system, redesign it. Now, there's a lot of options out there people have talked about how to redesign our healthcare system, and I'm not sure any of them is quite right. Whatever solution is chosen, we need to achieve universal coverage at a much lower cost. But the solution must also have a broad appeal. It must be nonpartisan and it must be a win-win. If we give one political party everything it wants and the other party nothing it wants, nothing will get done. It won't pass. And what we will do is sit here having a philosophical and intellectually pure discussion that leads to no change. I'm not interested in philosophy. I'm interested in a working, functional healthcare system that isn't a great ripoff of the American people. And if you're going to get there, you're going to need to look for win-win compromises where the parties come together, focus on what's truly core important to them, and let other things go so that both parties have something they can grab onto in the new plan. The new plan is also going to have to accommodate some very deeply held US cultural roots, some of which are intrinsically in opposition, like "Don't tread on me" and "United we stand, divided we fall." How we resolve the tension between these core aspects of US culture is going to be integral to getting a successful health system designed and implemented. So how do we do it? Well, one question we could start with is, how did we get into this mess in the first place? How did our US system turn into such a mess? And the fact is, as I describe in Broken, Bankrupt, and Dying, the US healthcare system was never purposefully or rationally designed to deliver healthcare. It's actually an accident of history. It's an accident of tax laws from the 1940s. So if we didn't rationally design the system and it's an accidental sort of outgrowth of history, Can we look around to other countries and see how they rationally design their healthcare systems to make them work? If we know where we started and we know where we are now, and we can look around at how other people have redesigned their systems, maybe we can get some ideas about how to resolve these complex issues. These are the key questions that have to be asked, and they are answered in Broken, Bankrupt, and Dying. I urge you to check out the book, join the movement, demand an end to the great American healthcare ripoff. Thank you.